AAPM and R American Academy of Physical Medicine and Rehabilitation. Access to care, the ability and ease of clients to obtain health care when they need it. Accessible, a term used to denote building facilities that are barrier-free, thus enabling all members of society safe access, including persons with physical disabilities. Accountable Care Organization (ACO), a set of health care providers including primary care physicians, specialists, and hospitals that work together collaboratively and accept collective accountability for the cost and quality of care delivered to a population of patients. ACOs became popular in the Medicare fee-for-service benefits system as a result of the Affordable Care Act. ACOs are formed around a variety of existing types of provider organizations such as multi-specialty medical groups, physician hospital organizations, FA, and organized or integrated delivery systems. Accountable Care Facts, available at Accessed. Accreditation, a standardized program for evaluating health care organizations to ensure a specified level of quality, as defined by a set of national industry standards. Organizations that meet accreditation standards receive an official authorization or approval of their services. Accreditation entails a voluntary survey process that assesses the extent of a health care organization's compliance with the standards for the purpose of improving the systems and processes of care performance, and, in so doing, improving client outcomes. Actionable toward a legal duty, imposed by statute or otherwise, owing by defendant to the one injured. Active listening, a structured way of communication and interacting in which one is actively engaged with the speaker primarily through focused attention and suspension of one's own frame of reference, biases, distractions and judgment. A communication technique that improves personal relationships, fosters understanding, and facilitates cooperation and collaboration and eliminates conflict. Activities of daily living, routine activities an individual tends to do every day for self-care and normal ADLS living. These include eating, bathing, grooming, dressing, toileting, transferring, such as walking, bed to chair, and continence. Assessment of an individual's ability to perform these ADLs is important for determining an individual's ability, independence, disability or limitations. This assessment determines the type of long-term care and benefit coverage the individual needs. Care may include placement in a nursing home, skilled care facility or home care services. Benefit coverage may include Medicare, Medicaid or long-term care insurance. Activity limitations, difficulties an individual may have in executing activities. An activity limitation may range from a slight to a severe deviation in terms of quality or quantity in executing the activity in a manner or to the extent that is expected of people without the health condition. Actual value, also referred to as real value, measures the worth one derives from using or consuming a good, product, service or an item, and represents the utility of the good, product, service, or item. Actuarial study, statistical analysis of a population based on its utilization of health care services and demographic trends of the population. Results used to estimate health care plan premiums or costs. Actuary, a trained insurance professional who specializes in determining policy rates, calculating premiums, and conducting statistical studies. Acuity, complexity and severity of the client's health, medical condition. Acute care, the acute care delivery systems focus on treating sudden and acute episodes of illness such as medical and surgical management or emergency treatment, which otherwise cannot be taken care of in a less intense care setting. Acute care settings may include hospitals, acute rehabilitation centers, emergency care, transitional hospitals, and follow-up long-term disease management settings. ADA, Americans with Disabilities Act of 1990. ADA Amendments, ACT, ADAAA, Americans with Disabilities Act Amendments Act of 2008. ADL, activities of daily living. Routine activities carried out for personal hygiene and health and for operating a household. ADLs include feeding, bathing, showering, dressing, getting in or out of bed or a chair, and using the toilet. Adaptive behavior, the effectiveness and degree to which an individual meets standards of self-sufficiency and social responsibility for his/her age-related cultural group. Adherence, the extent to which a person's behavior taking medication, following a diet, and/or executing lifestyle changes, corresponds with agreed recommendations, e.g., health regimen, from a health care provider, Sabate, 2003. Adhesive contract, a contract between two parties where one party with stronger bargaining power sets the terms and conditions and the other party, which is the weaker of the two with little to no ability to negotiate, must adhere to the contract and is placed in a take-it-or-leave-it position. Cornell University Law School, Legal Information Institute. Adjusted Clinical Group (ACG) system, developed by the School of Public Health at Johns Hopkins University. This system clusters clients into homogeneous groups, 102 discrete groups, based on a unique approach to measuring morbidity to ultimately improve accuracy and fairness in evaluating health care provider performance, identifying clients at high risk, forecasting health care utilization, and setting equitable payment structure and rates for the providers of care. The system accounts for the burden of morbidity in a client population based on disease patterns, age, and gender and relies on the diagnostic and/or pharmaceutical code information found in insurance claims or other computerized client health records. The Johns Hopkins University, 2010, retrieved from Adjuster, a person who handles claims, also referred to as Claims Service Representative. ADLSC, activities of daily living. Administrative law, that branch of public law that deals with the various organizations of federal, state, and local governments which prescribes in detail the manner of their activities. Administrative services only, ASO, an insurance company or third-party administrator, TPA, that delivers administrative services to an employer group. This usually requires the employer to be at risk for the cost of health care services provided, which the ASO processes and manages claims. Admission certification, a form of utilization review in which an assessment is made of the medical necessity of a client's admission to a hospital or other inpatient facility. Admission certification ensures that clients requiring a hospital-based level of care and length of stay appropriate for the admission diagnosis are usually assigned and certified, and payment for the services are approved. Admission review, a review that occurs within 24 hours of a client's admission to a health care facility, e.g., a hospital, or according to the time frame required in the contractual agreement between the health care provider and the health insurance plan. This review ensures that the client's care in an inpatient setting is necessary, based on the client's health condition and intensity of the services needed. Advance directive, legally executed document that explains the client's health care-related wishes and decisions. It is drawn up while the client is still competent and is used if the client becomes incapacitated or incompetent. Adverse events, any untoward occurrences, which under most conditions are not natural consequences of the client's disease process or treatment outcomes. Advocacy, the act of recommending, pleading the cause of another, to speak or write in favor of. CMSA Standards of Practice, 2010, p. 24. Advocate, a person or agency who speaks on behalf of others and promotes their cause. Affect, the observable emotional condition of an individual at any given time. Affidavit, a written statement of fact signed and sworn before a person authorized to administer an oath. Aggregated Diagnosis Groups, ADGS, a grouping of diagnosis codes that are similar in terms of severity and likelihood of persistence in a client's health condition over time. An individual client can suffer more than one health condition and therefore may have more than one ADG, total of 32 ADG clusters. Individual diseases or conditions are placed into a single ADG based on a set of criteria including likely persistence of diagnosis, severity of illness, etiology, diagnostic certainty, and need for specialty care interventions. This system was developed by the Bloomberg School of Public Health at Johns Hopkins University. Agreed medical examination and evaluation conducted by a provider who is selected by agreement between an injured worker's attorney and the insurance claims administrator and/or attorney. The parties agree to conduct a medical examination and prepare a medical legal report to help resolve an existing dispute. The evaluation also serves to determine what portions of the work-related injury have contributed to the disability and what portions have resulted from other sources or causation. AHA American Heart Association. AHRQ Agency for Healthcare Research and Quality. Algorithm: the chronological delineation of the steps in, or activities of client care to be applied in the care of clients as they relate to specific conditions, situations. Alternate level of care: a level of care that can safely be used in place of the current level and determined based on the acuity and complexity of the client's condition and the type of needed services and resources. AMA American Medical Association. Ambulatory Payment Classification (APC). System and encounter-based classification system for outpatient reimbursement, including hospital-based clinics, emergency departments, observation, and ambulatory surgery. Payment rates are based on categories of services that are similar in cost and resource utilization. ANA American Nurses Association. ANCC American Nurses Credentialing Center. Ancillary services: other diagnostic and therapeutic services that may be involved in the care of clients other than nursing or medicine. Includes respiratory, laboratory, radiology, nutrition, physical and occupational therapy, and pastoral services. APCC Ambulatory Payment Classification. Appeal: care provision related, the formal process or request to reconsider a decision made not to approve an admission or health care services, reimbursement for services rendered, or a client's request for postponing the discharge date and extending the length of stay. Appeal: legal in nature, the process whereby a court of appeals reviews the record of written materials from a trial court proceeding to determine if errors were made that might lead to a reversal of the trial court's decision. Appropriateness of setting used to determine if the level of care needed is being delivered in the most appropriate and cost-effective setting possible. Approval to offer or receive affirmation, sanction, or agreement about a decision, action, service, treatment, or intervention. In the area of health insurance, it is the act of authorizing or affirming a service to a client that implies agreement to be responsible for reimbursing the provider of the service the related cost of providing the service to a client. Support system. Approved charge: the amount Medicare pays a physician based on the Medicare fee schedule. Physicians may bill the beneficiaries for an additional amount, subject to the limiting charge allowed. ASOC Administrative services only. Assessing: the process of collecting in-depth information about a client and his support system in order to identify the needs and decide upon the best case management services to address these needs. Similar to screening, however to a greater depth. Assessment: the process of collecting in-depth information about a person's situation and functioning to identify individual needs in order to develop a comprehensive case management plan that will address those needs. In addition to direct client contact, information should be gathered from other relevant sources: patient, client, professional caregivers, non-professional caregivers, employers, health records, educational, military records, etc. Assignment of benefits: paying medical benefits directly to a provider of care rather than to a member. This system generally requires either a contractual agreement between the health plan and provider or written permission from the subscriber for the provider to bill the health plan. Assistive device: any tool that is designed, made, or adapted to assist a person to perform a particular task. Assistive technology: any item, piece of equipment, or product system, whether acquired commercially or off the shelf, modified, or customized, that is used to increase, maintain, or improve functional capabilities of individuals with disabilities. Assistive technology services: any service that directly assists an individual with a disability in the selection, acquisition, or use of an assistive technology device. Assumption of risk: a doctrine based upon voluntary exposure to a known risk. It is distinguished from contributory negligence, which is based on carelessness, in that it involves a comprehension that a peril is to be encountered and a willingness to encounter it. Assurance, insurance: the term assurance is used more commonly in Canada and Great Britain. The term insurance is the spreading of risk among many, among whom few are likely to suffer loss. The terms are generally accepted as synonymous. Authorization: the approval of client care services, admission, or length of stay by a health benefit plan, e.g., HMO, PPO, based on information provided by the healthcare provider. Autonomy: agreement to respect another's right to self-determine a course of action, support of independent decision-making. Beauchamp, T.L. and Childress, J.F. Principles of Biomedical Ethics, 6th ed. 2009, NY, Oxford University Press, p. 38-39. Bad faith: generally involving actual or constructive fraud, or a design to mislead or deceive another. Barrier-free: a physical, man-made environment or arrangement of structures that is safe and accessible to persons with disabilities. Barriers: factors in a person's environment that, if absent or present, limit one's functioning and create disability. Examples are a physical environment that is inaccessible, lack of relevant assistive technology, and negative attitudes of people toward disability. Barriers also include services, systems, and policies that are either non-existent or that hinder the involvement of people with a health condition in any area of life. Burden Assessment Scale. Benchmarking: an act of comparing a work process with that of the best competitor. Through this process one is able to identify what performance measure levels must be surpassed. Benchmarking assists an organization in assessing its strengths and weaknesses and in finding and implementing best practices. Beneficence: compassion, taking positive action to help others, desire to do good, core principle of client advocacy. Beauchamp, T.L. and Childress, J.F. Principles of Biomedical Ethics, 6th ed. 2009, NY, Oxford University Press, p. 38-39. Beneficiary: an individual eligible for benefits under a particular plan. In managed care organizations, beneficiaries may also be known as members in HMO plans or enrollees in PPO plans. Benefit package: the sum of services for which a health plan, government agency, or employer contracts to provide. In addition to basic physician and hospital services, some plans also cover prescriptions, dental, and vision care. Benefit programs: government agency, or employer to individuals based on some sort of an agreement between the parties, for example between an employer and an employee. Benefits vary based on the plan and may include physician and hospital services, prescriptions, dental and vision care, workers' compensation, long-term care, mental and behavioral health, disability and accidental death, counseling and other therapies such as chiropractor care. Benefits principal term: the type of health and human services covered by an insurance company, health plan and is agreed upon between the plan, insurance company and the individual enrollee or participant. Benefits also refers to the amount payable by an insurance company to a claimant or beneficiary under the claimant's specific coverage as stipulated in the agreed upon health plan. Beyond, outside, the walls case management models where healthcare resources, services and case managers are based externally to an acute care, hospital setting, that is in the community. Board certified case manager. A case manager who has earned the Certified Case Manager (CCM) credential offered by the Commission for Case Manager Certification (CCMC). This involves passing an evidence-based certification examination after meeting a set of criteria that qualifies the case manager to sit for the examination. Once certified, the case manager must maintain the certification by acquiring ongoing education through means of continuing education units (CIUS) and uphold the CCM Code of Professional Conduct for Case Managers. Body of knowledge (BOK), widely recognized information, standards, methods, tools, and practices about a specific field. A BOK usually includes a comprehensive set of concepts, terms, tools, and activities that make up a profession, as defined by a relevant professional society. While the term body of knowledge is used to describe the document that defines that knowledge, the body of knowledge itself is a dynamic reference that is more than simply a collection of terms and concepts. A professional reading list, a library, a website or a collection of websites, a description of professional functions, or even a collection of information. Wikipedia, 2010. Therefore, one may then describe a BOK as a prescribed aggregation of essential knowledge in a particular field or specialty. An individual within the field is expected to have mastered to effectively practice and be considered a practitioner within the specialty. Babylon Online Dictionary, 2009. Bona fide literally translated as, in good faith. Brain disorder, a loosely used term for a neurological disorder or syndrome indicating impairment or injury to brain tissue. Brain injury, any damage to tissues of the brain that leads to impairment of the function of the central nervous system. Burden of proof, the duty of producing evidence as the case progresses, and/or the duty to establish the truth of the claim by a preponderance of the evidence. The former may pass from party to party, the later rests throughout upon the party asserting the affirmative of the issue. Capacity, a construct that indicates the highest probable level of functioning a person may reach. Capacity is measured in a uniform or standard environment, and thus reflects the environmentally adjusted ability of the individual. Capitation, a fixed amount of money per member per month (PMPM) paid to a care provider for covered services rather than based on specific services provided. The typical reimbursement method used by HMOs. Whether a member uses the health service once or more than once, a provider who is capitated receives the same payment. Captive, an insurance company formed by an employer to assume its workers' compensation and other risks, and provide services. Care Continuum Alliance, previously known as the Disease Management Association of America (DMAA). Care coordination, the deliberate organization of patient care activities between two or more participants, including the patient, involved in patient's care to facilitate the appropriate delivery of health care services. Organizing care involves the marshalling of personnel and other resources needed to carry out all required patient care activities and is often managed by the exchange of information among participants responsible for different aspects of care. McDonald et al., 2010. Care Coordination Hub, the context of delivering integrated health care services to clients, support systems with special emphasis on collaboration, coordination and communication among multiple health care providers, care settings and agencies in an attempt to ensure clients' safety and the provision of quality, cost-effective case management services. Care guidelines, nationally recognized and professionally supported plans of care recommended for the care management of clients with a specific diagnosis or health condition and in a particular care setting. Usually developed based on the latest available evidence and modified as necessary by health care professionals upon implementation for the care of an individual client. See also Case Management Plan. Care management, a health care delivery process that helps achieve better health outcomes by anticipating and linking clients with the services they need more quickly. It also helps avoid unnecessary services by preventing medical problems from escalating. Care setting. See also practice setting, level of care. A place across the continuum of health and human services where a client may receive health care services dependent on need. Care settings vary based on intensity and complexity of the services provided to clients, that is, from least complex, e.g., prevention and wellness, to most complex, e.g., acute and critical care services. Caregiver principal term, the person responsible for caring for a client in the home setting. Can be a family member, friend, volunteer, or an assigned healthcare professional. CARF Commission on Accreditation of Rehabilitation Facilities. A private, non-profit organization that establishes standards of quality for services to people with disabilities and offers voluntary accreditation for rehabilitation facilities based on a set of nationally recognized standards. Carpal tunnel syndrome, the name given to the symptoms that occur when the nerves and tendons running through the carpal tunnel of the wrist are compressed by tissue or bone or become irritated and swell. The carpal tunnel itself is a narrow passage in the wrist comprised of bones and ligaments through which nerves and tendons pass into the hand. Also referred to as cumulative trauma injury disorder, repetitive motion injury, and repetitive stress syndrome. Carrier. The insurance company are the one who agrees to pay the losses. A carrier may be organized as a company, either stock, mutual, or reciprocal, or as an association or underwriters. Carve out. Services excluded from a provider contract that may be covered through arrangements with other providers. Providers are not financially responsible for services carved out of their contract. Case-based review. The process of evaluating the quality and appropriateness of care based on the review of individual medical records to determine whether the care delivered is acceptable. It is performed by health care professionals assigned by the hospital or an outside agency, e.g., peer review organization pro. Case closure. Terminating the provision of case management services to a client support system. The process of communicating the decision to terminate services to clients, support systems, payer representative, and other health care professional involved. Case conference. A multidisciplinary health care team meeting that is held to discuss a client or client support system situation such as conflict in decision-making between the client and client support system, clarification of plan of care and prognosis, end-of-life issues, or an ethical dilemma. Depending on the purpose of the conference, the client and client support system may or may not participate in the meeting. Other participants are the case manager, social worker, physician of record or primary care provider, specialty care provider, registered nurse, registered dietitian, physical therapist, occupational therapist, ethicist, if the purpose is an ethical dilemma, and others as necessary. Case law. The aggregate of reported cases forming a body of jurisprudence, or the law of a particular subject as evidenced or formed by the adjudged cases, in distinction to statutes and other sources of law. Case management, a collaborative process that assesses, plans, implements, coordinates, monitors, and evaluates the options and services required to meet the client's health and human services needs. It is characterized by advocacy, communication, and resource management and promotes quality and cost-effective interventions and outcomes. CCMC 2010. Case Management Body of Knowledge (CMBOK), a comprehensive resource of essential knowledge in the field of case management that a case manager is expected to master and become knowledgeable, skilled, as well as experienced in, to effectively care for clients and their support systems and be considered a competent case management practitioner. Case Management Department, a division within a healthcare organization, e.g., provider, employer, or payer, responsible for the provision of case management services to clients and their support systems. Case management model, a conceptual or graphic representation of the practice of case management in an organization. It usually depicts the relationships among the key functions and stakeholders of case management, and the roles and responsibilities of case managers. Case management plan: a timeline of patient care activities and expected outcomes of care that address the plan of care of each discipline involved in the care of a particular patient. It is usually developed prospectively by an interdisciplinary healthcare team in relation to a patient's diagnosis, health problem, or surgical procedure. Case management plan of care: principal term, a comprehensive plan of care for an individual client that describes the 1. Problems, needs and desires determined based upon findings of the client's assessment. 2. Strategies such as treatments and interventions to be instituted to address the problems and needs, and 3. Measurable goals including specific outcomes to be achieved to demonstrate resolution of the problems and needs, the timeframes for achieving them, the resources available and to be used to realize the outcomes, and the desires, motivation of the client that may have an impact on the plan. CMSA 2010. Case management process: principal term, the context in which case managers provide health and human services to clients and their support systems. The process consists of several steps or sub-processes that are iterative, cyclical and recursive rather than linear in nature and applied until the client's needs and interests are met. The steps include screening, assessing, stratifying risk, planning, implementing, following up, transitioning, post-transitioning communication, and evaluating outcomes. The process, with special intervention by case managers, work together with clients and their support systems to evaluate and understand the care options available to the clients, identify what is best to meet their needs, and institute action to achieve their goals and meet their interests and expectations. Case management program: an organized approach to the provision of case management services to clients and their support systems. The program is usually described in terms of 1. Vision, mission and objectives. 2. Number and type of staff including roles, responsibilities and expectations, and 3. A specific model or conceptual framework that delineates the key case management functions which may include clinical care management, transitional planning, resources utilization and management, bed capacity management, clinical documentation enhancement, quality and variance, delays management and others depending on the healthcare organization. Case manager: principal term, a health and human services professional who is responsible for coordinating the overall care, services and resources delivered to an individual client or a group of clients and their support systems based on the client's health and human services issues, needs and interests. Case mix: complexity and indication of the severity of illness, prognosis, treatment difficulty, need for intervention, or resource intensity of a group of clients. Case mix group (CMG). Each CMG has a relative weight that determines the base payment rate for inpatient rehabilitation facilities under the Medicare system. See also IRF-PI-RIC. Case Mix Index (CMI), the sum of DRG relative weights of all patients, cases seen during a one-year period in an organization, divided by the number of cases hospitalized and treated during the same year. Case rates: rate of reimbursement that packages pricing for a certain category of services. Typically combines facility and professional practitioner fees for care and services. Case reserve: the dollar amount stated in a claim file which represents the estimate of the amount unpaid. Caseload: the total number of clients followed by a case manager at any point in time. Casualty insurance: a general class of insurance and workers' compensation insurance. Catastrophic case: any medical condition or illness that has heightened medical, social and financial consequences that responds positively to the control offered through a systematic effort of case management. Catastrophic case management: specialized and intricate services reflective of the needs of individuals with complex and life-altering conditions, e.g., severe injury, multiple comorbidities, and permanent disabilities. Often catastrophic case management includes a full spectrum of services for the individual or worker with a catastrophic injury or illness, sometimes including both disability case management and life care planning. Catastrophic illness: any medical condition or illness that has heightened medical, social, and financial consequences and responds positively to the control offered through a systematic effort of case management services. Catastrophic injury: a serious injury that results in severe and long-term effects on the individual who sustains it, including permanent severe functional disability. Examples are traumatic brain, spine, or spinal cord injury, multiple trauma, and loss of major body parts. CCM Certified Case Manager. CCMC Commission for Case Manager Certification. Certification: the approval of client care services, admission, or length of stay by a health benefit plan, e.g., HMO, PPO, based on information provided by the healthcare provider. Certified Nurse Life Care Planner, CNLCP, a registered professional nurse who holds a board certification from the Certified Nurse Life Care Planner Certification Board. This health professional develops a client-specific lifetime plan of care, while applying the nursing process. The plan employs a comprehensive and evidence-based approach in the estimation of current and future health care needs of the client. Also included are the associated costs and frequencies of items and services. Certified Vocational Evaluator, CVE, a professional specialized in vocational assessment and rehabilitation who has met the minimum requirements for nationally recognized voluntary certification. Certified Vocational Rehabilitation Provider. A vocational rehabilitation practitioner who is registered in the Workers' Compensation Agency or Commission in the state, jurisdiction of employment. This registration certifies that the rehabilitation practitioner is certified to provide vocational rehabilitation services to individuals with disabilities. Change management: a structured and systematic approach or process organized to move an organization, program, or team of individuals from a current to a future desired state. The process employs strategies and tools similar to project management through which change is formally introduced with a clearly stated goal. Some of the tactics applied in the change management process include but are not limited to ways to do the following: SAD face: 1. Communicate effectively, 2. Empower staff, 3. Minimize resistance, 4. Enhance adoption of change, 5. Establish and execute a roadmap for change, 6. Ensure sustainability, and 7. Achieve success. Change management is an organizational mandate that entails thoughtful planning, sensitive implementation, and consultation with, and involvement of, the people affected by the change. Chronic care model: a systems model that proposes several basic and specific elements for improving care in health systems at the community, organization, practice, and individual client levels. It ensures delivery of high-quality chronic disease care to clients with chronic illnesses. The elements of the model include the community, health system, self-management support, delivery system design, decision support, and use of clinical information systems. Evidence-based practices in each of these elements foster productive interactions between informed clients, support systems and their providers. Chronic illness: a health condition, disease, that lasts 3 months or longer. Civil case or suit: a case brought by one or more individuals to seek redress of some legal injury, or aspect of an injury, for which there are civil, non-criminal remedies. Claim: a request for payment of reparation for a loss covered by an insurance contract. Claimant: one who seeks a claim or one who asserts a right or demand in a legal proceeding. Claims adjuster: an insurance professional who investigates claims by interviewing the claimant and other involved parties, e.g., employers and witnesses, reviews related records to determine degree of liability and damages, and assures that an insurance policy exists and covers the claimed damages. In healthcare, a claims adjuster also assures that medical care is available to the worker as needed based on the injury or occupational illness. Claims service representative: a person who investigates losses and settles claims for an insurance carrier or the insured. A term preferred to adjuster. Client individual who is the recipient of case management services. This individual can be a patient, beneficiary, injured worker, claimant, enrollee, member, college student, resident, or health care consumer of any age group. In addition, when client is used, it may also infer the inclusion of the client's support. CMSA Standards of Practice, 2010 p. 24. Client source. The way a case manager comes in contact with a client to provide case management services, usually taking place either by a referral from another healthcare provider, the client, or a member of the client's support system. In some case management programs, client source may be based on screening of the client during a healthcare encounter. In other organizations, it is only based on a referral. Client-related outcomes, consequences, or results of care activities, processes, or services that are directly related to the client's condition, health status, and/or situation. Client's counseling. See counseling. Client's education. See education. Client's support system. Principal term, the persons identified by each individual client to be directly or indirectly involved in the client's care. It may include biological relatives, family members, spouses, partners, friends, neighbors, colleagues, or any individual who supports the client, caregivers, volunteers, clergy, spiritual advisors. CMSA 2010 p. 24. Clinical pathway. See case management plan. Clinical review criteria. The written screens, decision rules, medical protocols, or guidelines used to evaluate medical necessity, appropriateness, and level of care. CMAG Case Management Adherence Guidelines. CMBOK. See Case Management Body of Knowledge. CMG Case Mix Group. CMIC Case Mix Index. CMPC Case Management Plan. CMS Centers for Medicare and Medicaid Services, formerly known as the Health Care Financing Administration (HCFA). CMSA Case Management Society of America. COBC Coordination of Benefits. COBRA Consolidated Omnibus Budget Reconciliation Act. Coding. A mechanism of identifying and defining client care services, activities as primary and secondary diagnoses and procedures. The process is guided by the ICD-9 Coding Manual, which lists the various codes and their respective descriptions. Coding is usually done in preparation for reimbursement for services provided. Cognitive rehabilitation therapy programs which aid persons in managing specific problems in perception, memory, thinking, and problem solving. Skills or practices and strategies are taught to help improve function and/or compensate for remaining deficits. Coinsurance. A type of cost sharing in which the insured person pays or shares part of the medical bill, usually according to a fixed percentage. Collaboration. A process where two or more individuals work closely or jointly together to achieve a mutual goal or purpose such as resolving a problem or improving a situation. This process requires openness, mutual trust and respect, sharing of knowledge and consensus. Collaborative care. An evidence-based approach that involves the provision of mental health, behavioral health, and substance use services within a primary care setting. Commission on Accreditation of Rehabilitation Facilities. CARF, a private non-profit organization that establishes standards of quality for services to people with disabilities and offers voluntary accreditation for rehabilitation facilities based on a set of nationally recognized standards. Common law. A system of legal principles that does not derive its authority from statutory law, but from general usage and custom as evidenced by decisions of courts. Communication skills refers to the many ways of transferring thought from one person to another through the commonly used media of speech, written words, or bodily gestures. Community alternatives. Agencies, outside an institutional setting, which provide care, support, and/or services to people with disabilities. Community Assessment Risk Screen (CARS), an assessment tool used to determine the risk for a hospitalization or emergency department admittance of elderly clients. The tool focuses on the client's current health status and lifestyle behaviors similar to the Health Risk Assessment (HRA) tool, CESTA and Tahan, 2003. Community services and principal term, healthcare programs that offer specific services and resources in a community-based environment as opposed to an institutional setting, that is, outside the confines of healthcare facilities such as hospitals and nursing homes. These programs are either publicly or privately funded or charitable in nature. Community skills, those abilities needed to function independently in the community. They may include telephone skills, money management, pedestrian skills, use of public transportation, meal planning and cooking. Community-based support programs which are located in a community environment, as opposed to programs in institutional setting. Comorbidity, a pre-existing condition, usually chronic, that because of its presence with a specific condition causes an increase in the length of stay by about 1 day in 75% of the clients. Compensation, money that a court or other tribunal orders to be paid by a person whose acts or omissions have caused loss or injury to another, in order that the person indemnified may receive equal value for the loss, or be made whole in respect to the injury. Competence, the mental ability and capacity to make decisions, accomplish actions, and perform tasks that another person of similar background and training, or any human being, would be reasonably expected to perform adequately. Complainant, the party who files a complaint or on whose behalf a complaint is filed. A client. A member of the client's support system, an employer, a payer representative, or another case manager may file a complaint with CCMC. Complaint, a formal expression of concern that a board-certified case manager's behaviors does not adhere to CCMC's Code of Professional Conduct for case managers with standards, rules, procedures, and penalties. Complication, an unexpected condition that arises during a hospital stay or healthcare encounter that prolongs the length of stay at least by 1 day in 75% of the clients and intensifies the use of healthcare resources. Concurrent review, a method of reviewing client care and services during a hospital stay to validate the necessity of care and to explore alternatives to inpatient care. It is also a form of utilization review that tracks the consumption of resources and the progress of clients while being treated. Conditional, a rehabilitation professional who has not yet met all of the requirements to be a rehabilitation qualified rehabilitation professional. Professional. Confidential, certain classes of communications, passing between persons who stand in a communications. Confidential, of fiduciary relation to each other, or who, on account of their relative situation, are under a special duty of secrecy and fidelity, that the law will not permit to be divulged. Confidentiality. A situation where information is kept limited to the person having the authority or right to possess the information. For example, health care providers keeping a patient's personal health information private unless consent to release the information is provided by the patient. Health care providers assume the duty of protecting personal information about the patients they care for from others who do not have the right to access such information. In accordance with the Health Information Portability and Accountability Act of 1997 (HIPAA), healthcare organizations and providers are required to have policies to protect the privacy of patients' electronic information, including procedures for computer access and security. University of Washington School of Medicine, Ethics in Medicine, Bioethics Topics, Confidentiality, https://depths. Washington.edu/bioeth/topics/confident HTML, accessed 4 June 2015. Conflict of interest: a situation where an individual, e.g., an employee, executive, or public official, in a public or private organization who is in a position to exploit a professional or official capacity in some way that results in personal benefits at the expense of others in the same organization, agency, or community at large. Therefore an individual, especially one in a position of power, must not make decisions that are based on favoritism, personal gain, exploitation, or violation of the public trust. Such actions are forbidden under the Political Reform Act of 1974, whose purpose is to prohibit employees, especially public employees, from personally benefiting at the expense of the public interest. Political Reform Act of 1974, Government Code Section 81000 et sec. Closing parenthesis. Because there are some legal gray areas surrounding conflict of interest, it often falls on the individual to recognize potential problems before they interfere with his/her duties. Consensus agreement in opinion of experts. Building consensus is a method used when developing case management plans. Consent given by a patient, next of kin, legal guardian, or designated person for a kind of intervention, treatment, or service after the provision of sufficient information by the provider. A decision based on knowledge of the advantages and disadvantages and implications of choosing a particular course of action. Contempt of court: any act that is calculated to embarrass, hinder, delay or obstruct the court in the administration of justice, or that is calculated to lessen its authority of its dignity. Continued stay review. A type of review used to determine that each day of the hospital stay is necessary and that care is being rendered at the appropriate level. It takes place during a client's hospitalization for care. Continuous quality improvement (CQI). A key component of total quality management that uses rigorous, systematic, organization-wide processes to achieve ongoing improvement in the quality of healthcare services and operations. It focuses on both outcomes and processes of care. Continuum of care. The continuum of care matches ongoing needs of the individuals being served by the case management process with the appropriate level and type of health, medical, financial, legal and psychosocial care for services within a setting or across multiple settings. Contractor: a business entity that performs delegated functions on behalf of the organization. Contractual ethics: terms and conditions in a contract that are ethical in context and must be adhered to by the involved parties. Sometimes these terms are not explicit and impose moral rather than legal obligations, for example, undue influence and informed consent. Coordination: the process of organizing, securing, integrating, and modifying resources necessary to accomplish the goals set forth in the case management plan. Coordination of benefits: an agreement that uses language developed by the National Association of COB. Insurance commissioners and prevents double payment for services when a subscriber has coverage from two or more sources. Copayment: a supplemental cost-sharing arrangement between the member and the insurer, in which the member pays a specific charge for a specified service. Copayments may be flat or variable amounts per unit of service and may be for such things as physician office visits, prescriptions, or hospital services. The payment is incurred at the time of service. Core therapies: basic therapy services provided by professionals on a rehabilitation unit. Usually refers to nursing, physical therapy, occupational therapy, speech-language pathology, neuropsychology, social work and therapeutic recreation. CORF: comprehensive outpatient rehabilitation facility. Cost-benefit analysis: a technique or systematic process used to calculate and compare the benefits and costs of an action, intervention, service or treatment, and to determine how well, or how poorly, it will turn out. This analysis reveals whether the benefits outweigh the costs, and by how much, so that the involved party is able to make appropriate decisions. Counseling, a process of interaction that takes place in a safe, supportive, and comfortable environment between a case manager and a client or client support system. During this process, the client shares distressing or stressful experiences, situations, emotions, or thoughts in an effort to feel better. These experiences may include present or past circumstances of loss, bereavement, separation, life-changing events, or coping with sudden or chronic illness. Clients may seek counseling to help them explore a general feeling or emotion they are experiencing, how best to cope with it, or as an opportunity to undertake personal development. The case manager's role in a client's counseling is to facilitate effective client self-exploration, offer support to the client, be an active listener, and act in a non-judgmental manner. Counseling process, a process that uses relationship and therapeutic skills to foster the independence, growth, development, and behavioral change of persons with disabilities through the implementation of a working alliance between the counselor and the client. It involves communication, goal setting, and beneficial growth or change through self-advocacy, psychological, vocational, social, and/or behavioral interventions. CPR, computer-based patient record. CPT, current procedural terminology, a listing of descriptive terms and identifying codes for reporting medical services and procedures performed by health care providers and usually used for billing purposes. CQIC, continuous quality improvement. Credentialing, a review process to approve a provider who applies to participate in a health plan. Specific criteria are applied to evaluate participation in the plan. The review may include references, training, experience, demonstrated ability, licensure verification, and adequate malpractice insurance. Cross-examination, the questioning of a witness during a trial or deposition by the party opposing those who originally asked him/her to testify. Cultural competency, a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals and enables that system, agency, or those professionals to work effectively in cross-cultural situations. Culture, the thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. Custodial care, care provided primarily to assist a client in meeting the activities of daily living but not requiring skilled nursing care. Damages, money awarded by a court to someone who has been injured, plaintiff, and that must be paid by the party responsible for the injury, defendant. Normal damages are awarded when the injury is judged to be slight. Compensatory damages are awarded to repay or compensate the injured party for the injury incurred. Punitive damages are awarded when the injury is judged to have been committed maliciously or in wanton disregard of the injured plaintiff's interests. Database, an organized, comprehensive collection of client care data. Sometimes it is used for research or for quality improvement efforts. Days per thousand, a standard unit of measurement of utilization. Refers to an annualized use of the hospital or other institutional care. It is the number of hospital days that are used in a year for each 1,000 covered lives. DBA, Defense Base Act of 1941. Deafness, defined as a condition in which the auditory sense is not the primary means by which speech and language are learned and the sense of hearing is so lacking or drastically reduced as to prohibit normal function as a hearing person. Death benefit, the benefit payable to eligible dependents of the worker, i.e., spouse, children, whose occupational disease or on-the-job injury has resulted in the worker's death. This benefit may be payable at the rate of 2/3 of the deceased worker's average weekly wage at the time of the accident, not to exceed the maximum allowed under the law for all eligible dependents. Decision rule, a logical statement of characteristics, conditions, or attributes, e.g., effectiveness, worthiness, financial savings, that explain the appropriateness of making a specific decision or choice. For example, a healthcare executive concludes that a case management intervention is of positive return on investment if it demonstrates cost savings. Deductible: a specific amount of money the insured person must pay before the insurer's payments for covered health care services begin under a medical insurance plan. Defendant: the person against whom an action is brought to court because of alleged responsibility for violating one or more of the plaintiff's legally protected interests. Delay in service: used to identify delays in the delivery of needed services and to facilitate and expedite such services when necessary. Delegation: the process whereby an organization permits another entity to perform functions and assume responsibilities on behalf of the organization, while the organization retains final authority to provide oversight to the delegate. Demand management: telephone triage and online health advice services to reduce members' avoidable visits to health providers. This helps reduce unnecessary costs and contributes to better outcomes by helping members become more involved in their own care. Denial: no authorization or certification is given for health care services because of the inability to provide justification of medical necessity or appropriateness of treatment or length of stay. This can occur before, during, or after care provision. Department: a part, division, or program within an organization that has specific focus, objectives, function, or responsibility. For example, a materials management department within a hospital responsible primarily for the procurement and distribution of materials and supplies needed in a hospital for patient care services. Deposition: the testimony of a witness taken upon interrogatories not in open court, but in pursuance of a commission to take testimony issued by a court, or under a general law on the subject, and reduced to writing and duly authenticated, and intended to be used upon the trial of an action in court. Developmental disability: any mental and/or physical disability that has an onset before age 22 and may continue indefinitely. It can limit major life activities. Individuals with mental retardation, cerebral palsy, autism, epilepsy, and other seizure disorders, sensory impairments, congenital disabilities, traumatic brain injury, or conditions caused by disease, e.g., polio and muscular dystrophy, may be considered developmentally disabled. Developmental retardation: a term that has been suggested as a replacement for mental retardation. Removes confusion with mental health and mental illness. DHHS Department of Health and Human Services. Diagnosis-Related Group (DRG). A patient classification scheme that provides a means of relating the type of patient a hospital treats to the costs incurred by the hospital. DRGs demonstrate groups of patients using similar resource consumption and length of stay. It also is known as a statistical system of classifying any inpatient stay into groups for the purposes of payment. DRGs may be primary or secondary, an outlier classification also exists. This is the form of reimbursement that the CMS uses to pay hospitals for Medicare and Medicaid recipients. Also used by a few states for all payers and by many private health plans, usually non-HMO, for contracting purposes. Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, the most recent edition of the American Psychiatric Association's manual that is used by clinicians and researchers to diagnose and classify mental disorders, American Psychiatric Association, 2013. Dichotomous variable: a variable known to have only two characteristics or options when evaluated in a particular study or predictive modeling. For example, characteristics may be high or low, true or false, yes or no, present or absent. Diffusion of innovation: the spread of new technologies, ideas, or ways of doing things in a particular culture. It is the process of communicating change for the purpose of increasing the rate of its adoption and acceptance. Direct examination: the first interrogation or examination of a witness, on the merits, by the party on whose behalf he/she is called. Disability: a physical or neurological deviation in an individual makeup. It may refer to a physical, mental or sensory condition. A disability may or may not be a handicap to an individual, depending on one's adjustment to it diminished function, based on the anatomic, physiological or mental impairment that has reduced the individual's activity or presumed ability to engage in any substantial gainful activity. Inability or limitation in performing tasks, activities, and roles in the manner or within the range considered normal for a person of the same age, gender, culture and education. Can also refer to any restriction or lack, resulting from an impairment, of ability to perform an activity in the manner or within the range considered normal for a human being. Disability benefit funds from public or private sources provided for an individual who has a disability. Disability benefits for most Americans are covered and paid by the Social Security Administration, a government agency, through either of two main programs: 1. Social Security Disability Insurance (SSDI) for those who have worked in recent years, or 2. Supplemental Security Income (SSI) for low-income individuals who are disabled or who have become disabled and are unable to return to work. Disability case management, a process of managing occupational and non-occupational diseases with the aim of returning the disabled employee to a productive work schedule and employment. Disability cash benefit. Cash paid by a disability benefits insurance agency to a worker out on disability who has otherwise lost wages due to an inability to work. The cash is paid over a specific period of time and is equivalent to a predetermined percentage of the worker's weekly wages that have been lost due to inability to work. The amount is determined based on the average wages of the worker during a specific number of weeks, usually less than 10 weeks, most adjacent to the week during which the worker sustained the injury or illness. This benefit is also paid for a limited time period as stipulated by the disability insurance plan and based on state-specific laws. Disability income insurance, a form of health insurance that provides periodic payments to replace income when an insured person is unable to work as a result of illness, injury, or disease. Disability management program, a program that focuses on assisting workers who have suffered from occupational health conditions or job-related injuries return to work. It facilitates accommodations in the workplace to prevent impairment incidents of injured workers from becoming disability circumstances. It also employs the services of health professionals such as disability management specialists and/or disability case managers who are responsible for training and establishing tools for disability management personnel, employers, and others involved in keeping workers healthy, motivated, and productive. Discharge outcomes criteria, clinical criteria to be met before or at the time of the client's discharge. They are the expected, projected outcomes of care that indicate a safe discharge. Discharge planning. The process of assessing the client's needs of care after discharge from a health care facility and ensuring that the necessary services are in place before discharge. This process ensures a client's timely, appropriate, and safe discharge to the next level of care or setting, including appropriate use of resources necessary for ongoing care. Discharge screen assessment of the client, support systems discharge needs using a set of criteria that results in identifying clients who are to benefit from health care services or resources post an episode of illness and/or to prevent need for acute care rehospitalization. Discharge status disposition of the client at discharge, e.g., left against medical advice, expired, discharged home, transferred to a nursing home. Disclosure written authorization regarding the sharing of a client's information with other parties or in proceedings such as a complaint of an alleged ethical violation, which otherwise parties have no business being aware of such information. Discovery, the process by which one party to a civil suit can find out about matters that are relevant to his/her case, including information about what evidence the other side has, what witnesses will be called upon, and so on. Discovery devices for obtaining testimony, requests for documents or other tangibles, or requests for physical or mental examinations. Disease management, a system of coordinated healthcare interventions and communications for populations with chronic conditions in which client self-care efforts are significant. It supports the physician or practitioner-client relationship. The disease management plan of care emphasizes prevention of exacerbations and complications utilizing evidence-based practice guidelines and client empowerment strategies, and evaluates clinical, humanistic, and economic outcomes on an ongoing basis with the goal of improving overall health. Disengagement, the closing of a case, is a process of gradual or sudden withdrawal of services, as the situation indicates, on a planned basis. Disenrollment, the process of terminating health care insurance coverage for an enrollee, insured. Distributive justice deals with the moral basis for the dissemination of goods, andevils, burdens and benefits, especially when making decisions regarding the allocation of health care resources. DMAA, Disease Management Association of America. DMEC, Durable Medical Equipment. DNR, Do Not Resuscitate. DoD, Department of Defense. Domestic carrier, an insurance company organized and headquartered in a given state is referred to in that state as a domestic carrier. DRGSC, Diagnosis-Related Groups. Dual relationship. Dual relationships exist when a case manager has responsibilities toward a third party other than the client, e.g., case manager, payer, client, or case manager, employer, client. Durable medical equipment, DME, equipment needed by patients for self-care. Usually it must withstand repeated use, is used for a medical purpose, and is appropriate for use in the home setting. Early return to work. When a worker who had suffered a job-related injury or illness resumes work before complete recovery and while still suffering some sort of a partial disability. Usually the early return of the worker may involve the same job but with modified responsibilities or another job altogether. EBP, Evidence-Based Practice. EDSS, Expanded Disability Status Scale. Education, the process of assisting clients and their support systems to learn to behave in a manner conducive to the promotion, maintenance, or restoration of health. It entails formal and/or informal learning experiences that provide clients, support systems the opportunity to acquire information and skills needed to make quality health decisions, improve health literacy, and develop lifestyle behaviors that are conducive to health and wellness. EF, Executive Function. Effectiveness of care, the extent to which care is provided correctly, i.e., to meet the client's needs, improve quality of care, and resolve the client's problems, given the current state of knowledge, and the desired outcome is achieved. Efficacy of care, the potential, capacity or capability to produce the desired effect or outcome, as already shown, e.g. through scientific research, evidence-based findings. Efficiency of care, the extent to which care is provided to meet the desired effects, outcomes to improve quality of care and prevent the use of unnecessary resources. EHR, Electronic Health Record. Electronic medical record, a computerized medical and health record. A healthcare organization, e.g., a hospital, rehabilitation facility, physician's office or home care agency, uses as part of a health information system that allows documentation of important information about a client's status and care provision. It also allows storage, retrieval, and modification of records specific to the individual client the organization is caring for. Other terms used to refer to EMIR are Electronic Patient Record, EPR, Electronic Health Record, EHR, and Computer-Based Patient Record, CPR. Eligibility, the determination that an individual has met requirements to obtain benefits under a specific health plan contract. Emotional intelligence, the ability to sense, understand, and effectively apply the power and acumen of emotions as a source of energy, information, connection, and influence. It also is the ability to motivate oneself and persist in the face of frustration, control impulse, regulate one's mood, and keep distress from swamping the ability to think, empathize, and hope. Employability: having the skills and training that are commonly necessary in the labor market to be gainfully employed on a reasonably continuous basis, when considering the person's age, education, experience, physical, and mental capacities due to industrial injury or disease. EMRC Electronic Medical Record. EMTALA Emergency Medical Treatment and Active Labor Act. Encounter: an outpatient or ambulatory visit by a health plan member to a provider. It applies mainly to a physician's office but may also apply to other types of encounters. End result: outcomes that occur at the conclusion of an episode of care and indicate the achievement of target goals. For example, deciding to transition a client from the acute care to home setting after successful tolerance of oral antibiotics, or transitioning a workers' compensation client back to work after successful job modification interventions. Enrollee: an individual who subscribes for a health benefit plan provided by a public or private health care insurance organization. Enrollment: the number of members in an HMO. The process by which a health plan signs up individuals or groups of subscribers. Episode of care: a client's access to health care services or encounter with a health care provider. It is individual client-specific, time-limited, and always has a beginning and end. The length of the client's encounter with care varies based on the client's health needs, the type and intensity of the required services to effectively address the need, the care practice setting where the client receives these services, and level of care. Time of the encounter may be measured in minutes, e.g., in a provider's clinic or office; hours, e.g., in the emergency department, ambulatory surgery center or a dialysis center; days, e.g., in a hospital setting; or weeks to months, e.g., in a skilled nursing or rehabilitation facility. A client suffering from an illness may require one or multiple episodes of care before the illness is resolved or client is considered stable. EPOC Exclusive Provider Organization. EPR Electronic Patient Record. Ergonomics (OR) Human factors, the scientific discipline concerned with the understanding of interactions among humans and other elements of a system. It is the profession that applies theory, principles, data and methods to environmental design, including work environments, in order to optimize human well-being and overall system performance. Ergonomist: an individual who has 1. A mastery of ergonomics knowledge, 2. A command of the methodologies used by ergonomists in applying that knowledge to the design of a product, process, or environment, and 3. Has applied his or her knowledge to the analysis, design, test, and evaluation of products, processes, and environments. ERISA Employee Retirement Income Security Act. Evaluating outcomes: the final step of the case management process, which is achieved by measuring the results and consequences of the case management services provided to clients and their support systems. Evaluation: the process, repeated at appropriate intervals, of determining and documenting the case management plan's effectiveness in reaching desired outcomes and goals. This might lead to a modification or change in the case management plan in its entirety or in any of its component parts. CCMC Certification Guide, P7. Evidence: any species of proof, or probative matter, legally presented at the trial of an issue, by the act of the parties and through the medium of witnesses, records, documents, concrete objects, and the like, for the purpose of inducing beliefs in the minds of the court or jury as to their contention. Ex parte: a judicial proceeding, order, injunction, and so on, taken or granted at the instance and for the benefit of one party only, and without notice to, or contestation by, any person adversely interested. Exchange value: the tradability of a good or service and its associated price, i.e., what it is traded or exchanged for. Most often, exchange value is expressed using money. Smith, 2011. Exclusive Provider Organization (EPO). A managed care plan that provides benefits only if care is rendered by providers within a specific network. Executive function capacity of a person's working memory, which relies on own state of cognition, attention, aptitude, intellectual capacity, mental processes, ability to maintain focus, and ability to handle a breadth of ideas and facts. Cowan, Elliott, Scott Saltz et al., 2005. Experience, a term used to describe the relationship, usually in a percentage or ratio, of premium to claims for a planned coverage, or benefits for a stated period of time. Insurance companies in workers' compensation report three types of experience to rating bureaus: 1. Policy year experience, 2. Calendar year experience, and 3. Accident year experience. Policy year experience represents the premiums and losses on all policies that go into effect within a given 12-month period. Calendar year experience represents losses incurred and premiums earned within a given 12-month period. Accident year experience represents accidents that occur within a given 12-month period and the premiums earned during that time. Experience rating, the process of determining the premium rate for a group risk, wholly or partially on the basis of that group's experience. Experience refund, a provision in most group policies for the return of premium to the policyholder because of lower than anticipated claims. Expert witness, a person called to testify because of recognized competence in an area. External benchmarking, the act of comparing or evaluating the current performance of an organization or program against externally available data, standards, performance of competitors, national databases, or ideal practices. Fair hearing, one in which authority is executed fairly, that is consistent with the fundamental principles of justice embraced within the conception of due process of law. FAM, functional assessment measure. Fast functional assessment staging. FCEC, functional capacity evaluation. FECA, Federal Employees Compensation Act. Fee schedule, a listing of fee allowances for specific procedures or services that a health plan will reimburse. Fee for service, FFS, providers are paid for each service performed, as opposed to capitation. Fee schedules are an example of fee for service. FFSC, fee for service. Fidelity, the ethical principle that directs people to keep commitments or promises. Cotoni, R.R. and Tarvidas, V.M. Counseling, Ethics and Decision Making, 3rd ed. 2007, Pearson Merrill Prentice Hall, New Jersey, p. 500. Fiduciary person in a special relationship of trust, confidence or responsibility in which one party occupies a superior relationship and assumes a duty to act in the dependent's best interest. This includes a trustee, guardian, counselor or institution, but it could also be a volunteer acting in this special relationship. Field case management, FCM, also known as on-site case management. A form of care coordination and management whereby a case manager works with a client worker, in person rather than virtually via telephone or other electronic ways of communication. Field case managers usually visit the client's employer, work environment, treating physician, and other involved parties and collaborate with them on the return of the client to work. FIM instrument, see Functional Independence Measure, FIM trademark sign. First-level reviews conducted while the client is in the hospital, care is reviewed for its appropriateness. Following up the step of the case management process when case managers review, evaluate, monitor and reassess the client's health condition, needs, ability for self-care, knowledge of health condition and case management plan of care, outcomes of the implemented treatments and interventions, and continued appropriateness of the plan of care. Formulary, a list of prescription drugs that provide choices for effective medications from which providers may select that are covered under a specific health plan. Frame of reference, a set of ideas, evaluative criteria, rules, assumptions, or conditions a person uses to understand, perceive, and approach a situation or an issue. It is also the viewpoint or context within which a person's thinking about something seems to occur. Fraud: knowingly and willfully executing, or attempting to execute a scheme or artifice. To defraud any health care benefit program or to obtain, by means of false or fraudulent pretenses, representations, or promises, any of the money or property owned by, or under the custody or control of, any health care benefit program. Fraud is an intentional deception or misrepresentation that someone makes, knowing it is false, that could result in an unauthorized payment. Functional capacity: a systematic process of assessing an individual's physical capacities and evaluation FCE functional abilities. The FCE matches human performance levels to the demands of a specific job or work activity or occupation. It establishes the physical level of work an individual can perform. The FCE is useful in determining job placement, job accommodation or return to work after injury or illness. FCEs can provide objective information regarding functional workability and the determination of occupational disability status. Functional independence, referred to today as FIM-TM instrument, it is an 18-item instrument with an measure, FIM-TM, ordinal scale ranging from 1 total assistance to 7 complete independence that is used worldwide in the inpatient medical rehabilitation setting to measure a client's ability to function with independence. The instrument allows healthcare professionals to evaluate the amount of assistance required by a client to safely and effectively perform basic life functions. An FIM trademark sign score is collected within 72 hours after a client's admission to a rehabilitation unit, within 72 hours before discharge, and between 80 to 180 days after discharge. Items of the FIM trademark sign address a client's level of independence in the areas of eating, grooming, bathing, dressing, upper body, dressing, lower body, toileting, bladder management, bowel management. Transferring, to go from one place to another, in a bed, chair, and or wheelchair, transferring on and off a toilet, transferring into and out of a shower, locomotion, moving, for walking or in a wheelchair, and locomotion going up and down stairs. The FIM trademark sign instrument is also used to assess a client's cognitive abilities such as comprehension, expression, social interaction, problem solving, and memory. The typical people in a medical rehabilitation setting who complete the FIM instrument and assign scores to a client include physical therapists, occupational therapists, nurses, psychologists and social workers. This instrument is copyrighted and maintained by the Uniform Data System for Medical Rehabilitation, UDSMR, which is a division of the University of Buffalo Foundation Activities, Inc., UBFA, the not-for-profit corporation that developed and owns the FIM trademark sign instrument. MedFriendly, 2010. Funding systems: individuals or agencies that provide financial resources to support the care of those who are poor, vulnerable, lack health insurance coverage or unable to independently assume such responsibility. These may include charitable or religious organizations, and public or private agencies. Funeral expense benefit includes financial support for funeral expenses survivors of the deceased worker may incur. This benefit is payable to the deceased worker's family or dependents up to the maximum allowed under the law at the time of the worker's injury resulting in death. Gag rules: a clause in a provider's contract that prevents physicians or other providers from revealing a full range of treatment options to clients or, in some instances, from revealing their own financial self-interest in keeping treatment costs down. These rules have been banned by many states. Gatekeeper: a primary care physician, usually a family practitioner, internist, pediatrician, or nurse practitioner to whom a plan member is assigned. Responsible for managing all referrals for specialty care and other covered services used by the member. Global assessment lens: copyright, a multidimensional assessment that affords case managers the ability to be thorough and organized with respect to designing an individualized case management plan of care for each client to meet the client's unique situation. It includes an overview of the biophysical, psychological, sociological, and spiritual dimensions care. It functions as a care approach for case management assessment, which provides a comprehensive overview of 8 essential domains to be considered when contemplating a client's needs and opportunities. These domains include physical health, behavioral health, functional capacity, client engagement and self-management, social determinants of health, health information technology, data analytics and decision support, and transdisciplinary healthcare team. Global fee, a predetermined all-inclusive fee for a specific set of related services, treated as a single unit for billing or reimbursement purposes. Gold standard, also known as ideal practice, refers to the best available knowledge, evidence, or benchmark under reasonable or similar conditions. Group model HMO. The HMO contracts with a group of physicians for a set fee per client to provide many different health services in a central location. The group of physicians determines the compensation of each individual physician, often sharing profits. Guardian, a person appointed by the court to be a substitute decision maker for persons receiving services deemed to be incompetent of making informed decisions for themselves. The powers of a guardian are determined by a judge and may be limited to certain aspects of the person's life. Guidelines. See Practice Guidelines. Habilitation, the process by which a person with developmental disabilities is assisted in acquiring and maintaining life skills to 1. Cope more effectively with personal and developmental demands, and 2. To increase the level of physical, mental, vocational and social ability through services. Persons with developmental disabilities include anyone whose development has been delayed, interrupted or stopped, fixed by injury or disease after an initial period of normal development, as well as those with congenital condition. Handicap, the functional disadvantage and limitation of potentials based on a physical or mental impairment or disability that substantially limits or prevents the fulfillment of one or more major life activities, otherwise considered normal for that individual based on age, sex, and social and cultural factors, such as caring for one's self, performing manual tasks, walking, seeing, hearing, speaking, breathing, learning, working, etc. Handicap is a classification of role reduction resulting from circumstances that place an impaired or disabled person at a disadvantage compared to other persons. Handicapped refers to the disadvantage of an individual with a physical or mental impairment resulting in a handicap. Handoff, the act or an instance of passing something or the control of it from one person or agency to another. In healthcare context, handoff is passing of accountability and responsibility for a client's care from one clinician to another within a care setting or across care settings. This act is especially necessary during a transitions of care situation. HCC Hierarchical Conditions Category. HCFA Health Care Financing Administration. CCMS. Health principal term, an individual's physical, functional, mental, behavioral, emotional, psychosocial and cognitive condition. Refers to presence or absence of illness, disability, injury or limitation which requires special attention for management and resolution, including use of health and/or human services type intervention or resource. Health and Human Services Continuum principal term, the continuum of care that matches ongoing needs of case management clients and their support systems with the appropriate level and type of health, medical, financial, legal, psychosocial, behavioral and spiritual care and services across one or more care settings. The continuum includes multiple levels that vary in complexity and intensity of healthcare services and resources, including individual care providers and organizations or agencies. Health benefit plan, any written health insurance plan that pays for specific healthcare services on behalf of covered enrollees. Health insurance protection, which provides payment of benefits for coverage for covered sickness or injury. Included under this heading are various types of insurance such as accident insurance, disability income insurance, medical expense insurance, and accidental death and dismemberment insurance. Health insurance. Portability and accountability. ACT. HIPAA, a civil rights legislation that governs the portability and continuity of health insurance by protecting individuals against laws regarding pre-existing health conditions and other restrictions, especially when changing jobs or insurance carriers and plans. See also Health Insurance Portability and Accountability Acts. Privacy Rule. Health Insurance. Portability. ANDACCOUNTABILITY Acts. Privacy Rule. HIPAA's Privacy Rule was initially published in 2000 as a national law that ensures clients' medical information is kept confidential. The rule offered clients greater rights for protection of individually identifiable health information and files and demands that all health care providers maintain strict confidentiality and privacy. Department of Health and Human Services, Federal Register, 45 CFR, Parts 160 and 164, 2000. Health Maintenance Organization (HMO), an organization that provides or arranges for coverage of designated health services needed by plan members for a fixed prepaid premium. There are four basic models of HMOs: Group Model, Individual Practice Association (IPA), Network Model, and Staff Model. Under the Federal HMO Act, an organization must possess the following to call itself an HMO: 1. An organized system for providing health care in a geographical area, 2. An agreed-on set of basic and supplemental health maintenance and treatment services, and 3. A voluntarily enrolled group of people. Health policy. See also Public policy. The course of action to address a healthcare issue of concern by the community at large or specific groups within the community. This process involves the interplay of numerous individuals and interest groups collaborating to influence health policymakers to act in a particular way. Health Risk Assessment (HRA), an assessment of a client conducted to identify the presence of risk and determine how such risk may influence health-seeking behavior, e.g., access to healthcare services. This assessment may cover various aspects of a client's condition, e.g., level of physical activity and exercise, nutritional status, general health, safety, social and environmental wellness, emotional awareness, mental, intellectual, and occupational wellness, and culture, including values, spirituality, and beliefs. Healthcare continuum. Care settings that vary across a continuum based on levels of care that are also characterized by complexity and intensity of resources and services. Powell and Tahan, 2008, p. 43. See also Health and Human Services Continuum. Healthcare delivery system, a comprehensive model or structure used in the delivery of healthcare services to individuals, for example, Integrated Delivery System (IDS). Also includes HMOs, PPOs, POS, and EPOs. Powell and Tahan, 2008, pp. 20, 29-31. Healthcare home. The usual setting or level of care the client support system selects to use on a routine basis to receive healthcare services, such as a large or small medical group, a single practitioner, a community health center, or a hospital outpatient clinic. This is the central point for primary clinician caring for the client to coordinate necessary care and services based on the client's needs and preferences and among various care settings and providers. Healthcare proxy. A legal document that directs the healthcare provider, agency, and whom to contact for approval, consent of treatment decisions or options whenever the client is no longer deemed competent to decide for self. Healthcare trilogy. The quality, cost, and outcomes aspects of healthcare delivery. This term is attributed to the works of Don Abedian. Hearing a live proceeding done before a formal body with decision-making authority, e.g., CCMC's Committee on Ethics and Professional Conduct, for the purpose of presenting evidence about an issue, e.g., a complaint of an alleged ethical violation by a case manager, where concerned opposing parties, e.g., complainant and person complained against, are given the opportunity to share their side of the issue, e.g., experience, documentation of evidence, witnesses. This procedure ultimately allows the decision-making body to determine the outcome and share its conclusions with the opposing parties. Hearing impairment, loss of or compromised hearing. Hearsay evidence not proceeding from the personal knowledge of the witness, but from the mere repetition of what has been heard from others. HEDIS Health Care Effectiveness Data and Information Set. HHA Home Health Aid. HHRGC Home Health Resource Group. ICD-9-CMC International Classification of Diseases, 9th Revision, Clinical Modification. ICT Interdisciplinary Care Team. IDC Integrated Delivery System. IHI Institute for Healthcare Improvement. IM Important message from Medicare. Impairment, a general term indicating injury, deficiency or lessening of function. Impairment is a condition that is medically determined and relates to the loss or abnormality of psychological, physiological, or anatomical structure or function. Impairments are disturbances at the level of the organ and include defects or loss of limb, organ or other body structure or mental function, e.g. amputation, paralysis, mental retardation. Psychiatric disturbances is assessed by a physical impeach in the law of evidence. It is to call in question the veracity of a witness, by means of evidence adduced for that purpose. Implementation, the process of executing specific case management activities and/or interventions that will lead to accomplishing the goals set forth in the case management plan. Implementing the step in the case management process during which case managers execute specific case management activities and/or interventions to accomplish goals set forth in the case management plan of care and during the planning step. Important message from Medicare, IM, a notice of discharge from the acute care setting that hospitals are required to deliver to all Medicare beneficiaries, original Medicare beneficiaries and Medicare Advantage plan enrollees, who are hospitalized, informing them of their hospital discharge appeal rights. Incentive, a sum of money paid at the end of the year to health care providers by an insurance-managed care organization as a reward for the provision of quality and cost-effective care. Inclusive education. An educational model in which students with disabilities receive their education in a general educational setting with collaboration between general and special education teachers. Implementation may be through the total reorganization and redefinition of general and special education roles, or as one option in a continuum of available services. Indemnity, security against possible loss or damages. Reimbursement for loss that is paid in a predetermined amount in the event of covered loss. Indemnity benefits in the form of payments rather than services. In most cases, after the provider has billed the client, the insured person is reimbursed by the company. Independent case management, also known as private case management or external case management, it entails the provision of case management services by case managers who are either self-employed or are salaried employees in a privately owned case management firm. Independent living, a service delivery concept that encourages the maintenance of control over one's life based on the choice of acceptable options that minimize reliance on others performing everyday activities. Independent medical evaluation, see independent medical examination. Independent medical examination, an examination or evaluation that is completed by a healthcare professional, e.g., physician, physical therapist, psychologist, who has not been involved in the care of a worker who has sustained a work-related injury or illness. An employer or an insurance provider may request such an examination for a worker who is out of work on disability. The purpose of this examination is to determine the cause, extent, and medical treatment of a work-related or other injury where liability is at issue. It also assists in determining whether a worker has reached the maximum benefit from treatment and whether any permanent impairment remains after treatment. Indicator, a measure or metric that can be used to monitor and assess quality and outcomes of important aspects of care or services. It measures the performance of functions, processes, and outcomes of an organization. Individual Practice Association (IPA), a health maintenance organization (HMO), model of insurance that contracts with a private practice physician or healthcare association to provide healthcare services in return for a negotiated fee. The IPA then contracts with physicians who continue in their existing individual or group practice. Individual Written Rehabilitation Program (IWRP), an official document that clearly describes the individualized services that will enable a person with a disability to obtain and maintain suitable employment and/or to maximize independence in daily living. The formality of this document allows the vocational rehabilitation professional, e.g., counselor, and the person with the disability to translate findings of a vocational evaluation into specific rehabilitation goals and objectives. This document also includes the medical, social, psychological, educational, vocational, counseling, and employment services needed to accomplish the goal of the rehabilitation plan. Individualized Plan for Employment (IPE), a written plan that outlines an individual's vocational goal and the services to be provided to reach the goal. It formalizes the planning process through which the vocational goal, service delivery, and time frames for service delivery are determined. It also identifies the individual's employment objective consistent with his/her unique strengths, resources, priorities, concerns, abilities, and capabilities, while providing a plan for monitoring progress toward achievement of the goal. Informed consent given by a client, next of kin, legal guardian, or designated person for a kind of intervention, treatment, or service after the provision of sufficient information by the provider. A decision based on knowledge of the advantages and disadvantages and implications of choosing a particular course of action. Injury harm to a worker subject to treatment and/or compensable under workers' compensation. Any wrong, or damages done to another, either done to his/her person, rights, reputation, or property. Inpatient rehabilitation. Facilities patient assessment instrument. IRF-PI, a diagnostic used to classify patients into distinct groups based on clinical characteristics and expected resource needs. The PI determines the case mix group (CMG) classification. Instrumental Activities of Daily Living (IADLS), a set of skills necessary for an individual to maintain independent living. These skills require cognitive, emotional, and physical capacity for successful performance. They include the ability to use a telephone, shop for groceries, handle finances, perform housekeeping tasks, prepare meals, do laundry, take medications, and transportation use. These daily life functions are necessary for maintaining an individual's independent living. They also are affected by the presence of disease, injury, or developmental disability. Similar to ADLs, assessment of an individual's ability to perform these skills is important for determining an individual's ability, independence, disability, or limitations. This assessment determines whether an individual needs personal care services and the benefit coverage required. Insurance a system plan for a large number of people who are subject to the same loss and agree to have an insurer assess a premium, so when one suffers a loss, there is economic relief from the pooled resources. It also is known as protection by written contract against the financial hazards, in whole or part of the happenings of specified fortuitous events. Insured the person, organization, or other entity who purchases insurance. Insurer the insurance company or any other organization that assumes the risk and provides the policy to the insured. Intake. The decision a case manager makes about the provision of case management services to a client or client's support system. Usually a case manager makes an intake decision after considering basic information such as client's demographics, current health problem, medical and social history, psychosocial dynamics, treatment plan, risk status and others. Integrated behavioral health. The care a patient experiences is a result of a team of primary care and behavioral health clinicians, working together with patients and families, using a systematic and cost-effective approach to provide patient-centered care for a defined population. This care may address mental health and substance abuse conditions, health behaviors, including their contribution to chronic medical illnesses, life stressors and crises, stress-related physical symptoms, and ineffective patterns of health care utilization (AHRQ-ND). Integrated care, a concept that brings together inputs, delivery, management and organization of services related to diagnosis, treatment, care, rehabilitation, and health promotion. Integration is a means to improve services in relation to access, quality, user satisfaction, and efficiency. Garcia-Barbero, 2002. Integrated case management, a process by which a single case manager assists clients, support systems with all barriers to health, including those related to physical illnesses or mental health and substance use disorders, mental conditions. Handoffs among case managers and care providers are minimized, and total health outcomes for clients are the responsibility of each individual case manager. Cathal, Perez, and Cohen, 2010, p. She. Integrated Delivery System (IDS), a single organization or group of affiliated organizations that provides a wide spectrum of ambulatory and tertiary care and services. Care may also be provided across various settings of the healthcare continuum. Intensity of service is an acuity of illness criteria based on the evaluation, treatment plan, interventions, and anticipated outcomes. Interactive Voice Response (IVR) is a type of communication technology that allows individuals to interact with others, e.g., representatives of a company such as a health insurance plan, through the technology rather than actual people and via a telephone keypad or voice recognition system. During the automated interaction, individuals are able to address their own inquiries by following the automated IVR dialogue. The IVR technology employs pre-recorded audio to further direct users on how to proceed, usually following a menu of choices. Interactions proceed in a simple way from general options at first to more specific options later on in the dialogue. Interdisciplinary collaboration occurs among different disciplines that address interconnected aspects of the client's defined health problem or needs. The members of the team bring their own theories and frameworks to bear on the problem, and connections are sought among the disciplines to improve client outcomes. Albrecht, Freeman, and Higginbotham, 1998. Interdisciplinary Care Team (ICT), a team of healthcare professionals and paraprofessionals from different disciplines or departments within an organization who are involved in the care of a client, support system, share common care goals, and who have responsibility for complementary tasks, interventions, and/or treatments necessary to meet the client's goals. The team is interdependent and participates in ongoing communication among the team members and with the client support system to ensure the various aspects of the client's needs and wishes are addressed. Intermediate outcome, a desired outcome that is met during a client's hospital stay. IDIS, a milestone in the care of a client or a trigger point for advancement in the plan of care. Internal benchmarking. The act of comparing or evaluating the current performance of an organization or program against its past performance and improvement standards or targets. International classification of diseases, 9th revision. Clinical modification. ICD-9-CM, a text formulated to standardize diagnoses. It is used for coding medical records in preparation for reimbursement, particularly in the inpatient care setting. Internet. A public, cooperative creation that operates using national and international telecommunication technologies and networks, including high-speed data lines, phone lines, satellite communications, and radio networks. Interqual criteria, nationally recognized standards that describe when and how an individual client with a specific health condition is expected to progress through the continuum of healthcare and human services. They are developed applying a rigorous content process that ensures the criteria offer the best possible support for appropriateness of care and related clinical decision-making. The criteria are of three types: acute care, hospitals, behavioral health, and payer, and focus on care planning, level of care, clinical evidence summaries, and retrospective monitoring. McKesson, 2011. Interrogatories, a set or series of written questions composed for the purpose of being propounded to a party in equity, a garnishee, or a witness whose testimony is taken in a deposition. Intervention. Planned strategies and activities that modify a maladaptive behavior or state of being and facilitate growth and change. Intervention is analogous to the medical term treatment. Intervention may include activities such as advocacy, psychotherapy, or speech-language therapy. IOM Institute of Medicine. IPAC Individual Practice Association. IPA Individual Plan for Employment. IRF Inpatient Rehabilitation Facility. IRF PIC Inpatient Rehabilitation Facilities Patient Assessment Instrument. IC Intensity of Service. ID Information Technology. IV Intravenous. JCAHO Joint Commission on Accreditation of Health Care Organizations. JCI Joint Commission International. Job accommodation, a reasonable adjustment to a job or work environment that makes it possible for an individual with a disability to perform job duties. Determining whether to provide accommodations involves considering the required job tasks, the functional limitations of the person doing the job, the level of hardship to the employer, and other issues. Accommodations may include specialized equipment, facility modifications, adjustments to work schedules or job duties, as well as a whole range of other creative solutions. United States Department of Labor, 2010. Job adjustment. See work adjustment. Job analysis, a process to identify and determine in detail the particular job duties and requirements and the relative importance of these duties for a given job. Job analysis focuses on the specific job and not the person who occupies it at the time of analysis. It is conducted for purposes of a disabled worker's work accommodation or training, identification of required skills, competencies and qualifications, and legal defense. Job Bank Service, a computerized system developed by the Department of Labor that maintains an up-to-date listing of job vacancies available through the State Employment Service. Job Club, an organization of individuals who are seeking work, who join together to share information about employers, interviewing strategies, job-seeking skills, and work opportunities. Job Coach, an employment specialist who provides training and support to a person in the workplace. Job Development, customized employment process that consists of 1. An individualized determination of a person's strengths, capabilities, requirements and interests. 2. A customized work exploration and planning which ultimately results in an individualized career profile that includes clear delineation of a person's task list proposal for potential employers. 3. Development of a customized employment relationship with potential or actual employers, and 4. Outlining of the supports necessary for employment to be successful. United States Department of Labor, Office of Employment Disability, 2010. Job modification. See work modification. Job placement, the process of assisting an injured worker to find employment by matching the worker's skills, knowledge and abilities with a potential job. The process may entail interviews and testing for the purpose of achieving suitable job placements where there is a good match between an employer's needs and the worker's qualifications. Jurisdiction, an entity possessing official power to make legal decisions and judgments based upon the authority granted to it. Usually the entity represents a legal body that administers justice within a defined area of responsibility. Justice, the ethical principle that involves the idea of fairness and equality in terms of access to resources and treatment by others. Cotoni, R.R. and Tarvidas, V.M. Counseling Ethics and Decision Making, 3rd ed. 2007, Pearson Merrill Prentice Hall. New Jersey, p. 501. Knowledge Domain Principle Term, a cluster of health and human services or related topics. Information, grouped together based on a common theme to form a high-level, abstract concept that is considered to be essential for effective and competent performance of case managers, for example, case management principles of practice or healthcare reimbursement. Knowledge framework, what case managers need to know to effectively care for clients and their support systems. It includes a 9-step case management process and 7 essential knowledge domains applicable in any care or practice setting and for the various healthcare professionals who assume the case manager's role. KPSS Karnofsky Performance Status Scale. Learning disability, a lack of achievement or ability in a specific learning area S within the range of achievement of individuals with comparable mental ability. Most definitions emphasize a basic disorder in psychological processes involved in understanding and using language, spoken or written. Legal reserve, the minimum reserve which a company must keep to meet future claims and obligations as they are calculated under the state insurance code. Length of stay, loss, the number of days that a health plan member, client stays in an inpatient facility, home health, or hospice. Letter of instruction, a written statement expressing concern with a board-certified case manager's actions in regard to the CCMC's Code of Professional Conduct. The concern is not significant enough to warrant a more serious action or sanction, however, issuing of the letter of instruction serves as a reminder for the case manager to adhere to the code in his/her case management practice. Level of care principle term, the intensity and effort of health and human services and care activities required to diagnose, treat, preserve or maintain a client's health. Level of care may vary from least to most complex, least to most intense, or prevention and wellness to acute care and services. Levels of service based on the client's condition and the needed level of care, used to identify and verify that the client is receiving care at the appropriate level. LHWCA Longshore and Harbor Workers' Compensation Act. Liability, legal responsibility for failure to act appropriately or for actions that do not meet the standards of care, inflicting harm on another person. License, a permit to practice medicine or a health profession that is issued by a state or jurisdiction in the United States, and required for the performance of job functions. Licensure, a mandatory and official form of validation provided by a governmental agency in any state affirming that a practitioner has acquired the basic knowledge and skill and minimum degree of competence required for safe practice in his or her profession. Lien, a charge or security or encumbrance upon property. Life Care Plan, a dynamic document based on published standards of practice, comprehensive assessment, research, and data analysis, which provides an organized, concise plan for current and future needs of the client and support system, with associated costs, for individuals who have experienced catastrophic injury or have chronic health care needs. McCollum, 2004 p. 351. Life Care Planning, a holistic, person-centered approach to the management of healthcare and services of a person with complex, catastrophic, or life-altering condition or disability with the ultimate goal to promote and maintain the person's good health, safety, well-being, and quality of life. It applies a consistent methodology for analyzing all of the actual present and potential future needs and their associated expenses dictated by the onset of a catastrophic disability through to the end of life expectancy. Literacy, ability to read and write. Litigation, a contest in a court for the purpose of enforcing a right, particularly when inflicting harm on another person. Living will, a legal document that directs the health care team, provider in holding or withdrawing life support measures. It is usually prepared by the client while he or she is competent, indicating the client's wishes. Lobbying, a form of advocacy whereby an individual or group attempts to influence decisions made by those in positions of authority, power such as politicians, legislatures, regulators, government officials, agency executives, advocacy groups or others. Lobbyist, an individual, such as an advocate, who attempts to influence the decisions of those in positions of authority with the primary goal of promoting a special cause or agenda. Long-term disability income insurance. Insurance issued to an employee, group, or individual to provide a reasonable replacement of a portion of an employee's earned income lost through a serious prolonged illness during the normal work career. Lohr's level of rehabilitation scale. Loss, see length of stay. Loss control efforts by the insurer and the insured to prevent accidents and reduce loss through the maintenance and updating of health and safety procedures. Loss expense allocated, that part of expense paid by an insurance company in settling a particular claim, such as legal fees, by excluding the payments to the claimant. Loss ratio, the percent relationship which losses bear to premiums for a given period. Loss reserve, the dollar amount designated as the estimated cost of an accident at the time the first notice is received. Lost wages, the income a worker does not earn due to an inability to return to work as a result of a work-related disability or extended absence. Lost wages benefit, often in cases of lost wages due to a job-related disability and extended absence from work, the disabled worker is entitled to lost wages benefits. The amount of lost wages paid as a benefit to the worker while out on disability is determined based on state workers' compensation and disability laws and the worker's weekly income at the time the work-related injury or illness occurred. Other terms used to describe this benefit include cash benefit, disability cash benefit, and lost income benefit. Malpractice, improper care or treatment by a healthcare professional. Or wrongful conduct. Managed care, a system of health care delivery that aims to provide generalized structure and focus when managing the use, access, cost, quality, and effectiveness of healthcare services. Links the client to provider services. Managed competition, a state of health care delivery in which a large number of consumers choose among health plans that offer similar benefits. In theory, competition would be based on cost and quality and ideally would limit high prices and improve quality of care. Management service organization, a management entity owned by a hospital, physician organization, or third party. It contracts with payers and hospitals, physicians to provide certain health care management services such as negotiating fee schedules and handling administrative functions, including utilization management, billing, and collections. Mandatory outcomes reports, reports that consist of outcomes measures required by accreditation agencies such as the Joint Commission (TJC) or the National Committee for Quality Assurance (NCQA), and regulatory bodies such as the Centers for Medicare and Medicaid Services (CMS) or the Department of Health and Human Services (DHHS). They often are publicly reported. Examples are core measures submitted to CMS, or HEDIS measures submitted to NCQA. MAPS, see Multidisciplinary Action Plan. Maximum Medical Improvement (MMI), the point at which the health or medical condition of a worker who has sustained a work-related injury or illness has stabilized and further improvements are considered unlikely despite continued care and treatment. The treating physician at this time usually explains that no other reasonable treatment can be done to help the worker improve. MCO, Managed Care Organization. MDSC, Minimum Data Set. Measurement Indicator, see Indicator. Medicaid, a joint federal, state program which provides basic health insurance for persons with disabilities, or who are poor, or receive certain governmental income support benefits, i.e. Social Security income or SSI, and who meet income and resource limitations. Benefits may vary by state. May be referred to as Title 19 of the Social Security Act of 1966. Medicaid waiver programs, authorized under Section 1915(c) of the Social Security Act, provide states with greater flexibility to serve individuals with substantial long-term care needs at home or in the community rather than in an institution. The federal government waives certain Medicaid rules. This allows a state to select a portion of the population on Medicaid to receive specialized services not available to Medicaid recipients. Medical Disability Advisor, a reference that provides disability duration guidelines, mostly used as a source of accurate data for estimating the potential duration of a disability and therefore the timeframes of return to work for certain work-related diseases and injuries. Medical Durable Power of Attorney, a legal document that names a surrogate decision maker in the event that the patient becomes unable to make his or her own health care decisions. Medical health care services provided to manage physiologic and functional health conditions that relate to a person's biologic systems and organs. Medical home, a health care setting that facilitates partnerships between individual patients, clients, and their personal physicians, care providers, and when appropriate, the patient's family client's support system. Care is facilitated by registries, information technology, health information exchange and other means to assure that patients, clients, get the indicated care when and where they need and want it in a culturally and linguistically appropriate manner. NCQA 2010. Medical loss ratio, the ratio of health care costs to revenue received, calculated as total medical expense divided by total revenue. Medical necessity on admission, a type of review used to determine that the hospital admission is appropriate, clinically necessary, justified, and reimbursable. Medical Outcomes Study, short form 36, SF36, a research instrument used to measure an individual's perception of his/her own health status and quality of life. Medically necessary, a term used to describe the supplies and services provided to diagnose and treat a medical condition in accordance with nationally recognized standards. Medicare, a nationwide federally administered health insurance program that covers the cost of hospitalization, medical care, and some related services for eligible persons. Medicare has two parts. Part A covers inpatient hospital costs. Currently reimbursed prospectively using the DRG system. Medicare pays for pharmaceuticals provided in hospitals but not for those provided in outpatient settings. Also called Supplementary Medical Insurance Program. Part B covers outpatient costs for Medicare clients currently reimbursed retrospectively. Medicare Secondary Payer, a term generally used when the Medicare program does not have primary payment responsibility, that is, when another payer, insurance company has the responsibility for paying before Medicare. Medication reconciliation, the process of examining and monitoring all medications taken by a client to determine their compatibility, necessity and safety in order to reduce the number of adverse drug effects and promote clients' adherence to the medication regimen. McGonigal and Mastrian, 2008 p. 317. Mental health, a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. WHO 2014. Mental retardation, a broadly used term that refers to significantly sub-average general intellectual functioning manifested during developmental period and existing concurrently with impairment in adaptive behavior. Mentoring, a formal or informal relationship between two people, a senior mentor, usually and senior-level individual in the same organization as the protégé or an expert outside the protégé's chain of supervision or organization, and a junior protégé. The relationship aims to facilitate the professional development and advancement of the protégé. During this process the expert advises, guides, and further develops the protégé to facilitate meeting the protégé's career goals. Metabolic equivalent of task MET, a physiologic measure that expresses the energy cost of physical activities and is defined as the ratio of metabolic rate, or rate of energy consumption, during a specific physical activity to a reference metabolic rate, rate of energy consumption during rest. Milliman Care Guidelines, nationally recognized guidelines that offer integrated, diagnosis-specific references, footnotes, and abstracts. Clinicians and payers use them as tools to help drive higher quality of care, especially in the use of medical resources. The guidelines focus on reducing variances from best practice care delivery, provide tools that support discharge planning and care transitions, assist clinicians in the appropriate documentation of clients' levels of care, and support the delivery of client-centered care. Milliman Care Guidelines, 2011. Minimum data set, the assessment tool used in skilled nursing facility settings to place patients into resource utilization groups (RUGs), which determines the facility's reimbursement rate. MLRC Medical Loss Ratio. MMSE Mini Mental State Examination. Mobility, the ability to move about safely and efficiently within one's environment. Model, a conceptual or graphic representation of an object or phenomenon. It usually depicts the relationships among the key parts or ideas and thoughts of the phenomenon. Monitoring, the ongoing process of gathering sufficient information from relevant sources and its documentation regarding the case management plan and its activities and/or services to enable the case manager to determine the plan's effectiveness. Motion, a request to the court to take some action or to request the opposing side to take some action relating to a case. Motivation, a mental process, function, or instinct that produces and sustains incentive or drive in a client's behavior. It facilitates the abilities and intents of clients' support systems to reach their desired goals. Without motivation, effective change is not possible. Motivational interviewing, an effective communication technique applied to gather important information and obtain insights into a client's situation and health condition, focusing on the clinical, social, financial, mental, behavioral, and emotional aspects of the client's status. It is a style of communication that is supportive, empathic, and counseling-like that helps clients' support systems move more easily toward a course of successful and desirable change. MSP Medicare Secondary Payer. Multidisciplinary Action Plan (MAP), also known as a case management plan. A timeline of patient care activities and expected outcomes of care that address the plan of care of each discipline involved in the care of a particular patient. It is usually developed prospectively by an interdisciplinary health care team in relation to a patient's diagnosis, health problem or surgical procedure. NACCM National Academy of Certified Care Managers. NASW National Association of Social Workers. National Quality Measures Clearinghouse, also referred to as NQMC. It is a public resource for evidence-based quality measures and measure sets. The U.S. Department of Health and Human Services (HHS) sponsors this resource of quality measures through its affiliate, the Agency for Healthcare Research and Quality (AHRQ). NQMC provides the public with an inventory of the measures that are currently being used by the HHS for quality measurement, improvement, and reporting. Agency for Healthcare Research and Quality, 2011. NCQA National Committee for Quality Assurance. Negative predictive, the proportion of clients, also referred to as enrollees or members in a health value (NPV) insurance plan, who are predicted to experience low-cost services that turn out to be truly low-cost. Negligence, failure to act as a reasonable person. Behavior is contrary to that of any ordinary person facing similar circumstances. Network model HMO, the fastest growing form of managed care. This plan contracts with a variety of groups of physicians and other providers in a network of care with organized referral patterns. Networks allow providers to practice outside the HMO. Never events healthcare events that are undesirable, considered rare but devastating, resulting in death or serious disability, for the client when they occur, and are classified as medical errors. They are preventable in nature and health care organizations and providers are pressured to eliminate or prevent their occurrence. Never events fall into 6 categories according to the National Quality Forum (NQF): surgical such as wrong site surgery, product of device such as contaminated drug, patient protection such as suicide, care management event such as wrong dose drug, environmental such as electric shock, and criminal such as sexual assault. AHRQPS Net 2010. No exparte case managers under no circumstances can discuss the medical treatment plan's communication with the treating physicians separate from the workers who suffered a work-related injury or illness. This extends not only to verbal but also to any written communications that the case manager may send to the treating physician. NONADHERENCE a person's behavior that does not correspond with agreed upon recommendations from a health care provider or demonstrates inability or indifference about following the recommendations, e.g., health regimen, such as continued tobacco use despite the instruction to give up smoking. NONDISABLING injury an injury which may require medical care, but does not result in loss of working time or income. Non-maleficence refraining from doing harm to others, that is, emphasizing quality care outcomes. NPP National Priorities Partnership. NQF National Quality Forum. Nurse Licensure Compact a legal agreement that allows nurses, based on enacted laws, to have one NLC, multi-state license, allowing them the ability to practice in both their home and other states that have agreed to belong to the compact. States that belong to the compact recognize the nurse's licensure from the state of residence and eliminate the requirement of the nurse needing licensure in each of the states he chooses to work in as long as the state belongs to the compact. Nursing case a process model using the components of case management in the delivery management aspects of nursing care. In nursing case management delivery systems, the role of the case manager is assumed by a registered professional nurse. See also case management. OASIS Outcome and Assessment Information Set, a prospective nursing assessment instrument completed by home health agencies at the time the patient is entered for home health services. Scoring determines the Home Health Resource Group, HHRG. Observation status a condition under which clients who appear in the emergency department (ED) but need a little more time after their ED stay to sort out whether they truly need admission to an acute care hospital setting as inpatients. Care for these clients usually lasts less than 24 hours although sometimes may extend to a few days. Clients classified as observation status receive their care and services either in the ED itself or another part of the acute care hospital. Occupational disease a health condition or illness a worker experiences that is associated with the job responsibilities or work environment, e.g., hearing loss, emphysema, chronic obstructive pulmonary disease. Occupational health the protection, promotion, and maintenance of the safety, health and welfare of individuals in work or employment settings. It deals with all aspects of health and safety in the workplace with a strong focus on primary prevention of hazards with special focus on risk factors which lead to cancers, accidents, musculoskeletal diseases, respiratory diseases, hearing loss, circulatory diseases, stress-related disorders and communicable diseases. Occupational health focuses on the physical, mental, emotional and social well-being of workers in all occupations by preventing departures from health, controlling risks and the adaptation to the work environment. World Health Organization 2010. ODG Official Disability Guidelines. OIG Office of Inspector General. Ongoing risk stratification, a process in which case managers assign clients to risk groups upon or after they access a health care practice setting or enrollment in a health insurance plan and perhaps are receiving care. Case managers in this case update the risk stratification level of the client using administrative data such as claims data or assessments such as the Health Risk Assessment (HRA) and various screening tools. OSHA Occupational Safety and Health Administration. Outcome: the result and consequence of a healthcare process. A good outcome is a result that achieves the expected goal. An outcome may be the result of care received or not received. It represents the cumulative effects of one or more processes on a client at a defined point in time. Outcome indicators: measures of quality and cost of care. Metrics used to examine and evaluate the results of the care delivered. Outcomes management: the use of information and knowledge gained from outcomes monitoring to achieve optimal client outcomes through improved clinical decision-making and service delivery. Outcomes measurement: the systematic, quantitative observation, at a point in time, of outcome indicators. Outcomes monitoring: the repeated measurement over time of outcome indicators in a manner that permits causal inferences about what client characteristics, care processes, and resources produced the observed client outcomes. Outlier: something that is significantly well above or below an expected range or level. Outlier threshold: the upper range threshold in length of stay before a client's stay in a hospital becomes an outlier. It is the maximum number of days a client may stay in the hospital for the same fixed reimbursement rate. The outlier threshold is determined by the Centers for Medicare and Medicaid Services, CMS, formerly known as the Health Care Financing Administration, HCFA. Overutilizaton. Using established criteria as a guide, determination is made as to whether the client is receiving services that are redundant, unnecessary, or in excess. OWCP Office of Workers' Compensation Programs. PACC Post-Acute Care. Panel of providers usually refers to the health care providers, including physicians, who are responsible for providing care and services to the enrollee in a managed care organization. These providers deliver care to the enrollee based on a contractual agreement with the managed care organization. Partial disability: the result of an illness or injury which prevents an insert from performing one or more of the functions of his/her regular job. Pathophysiology: the physiology of abnormal states, specifically, the functional changes that accompany a particular syndrome or disease. Pathophysiology, N.D. Patient-centered. Medical home, PCMH, an approach to providing comprehensive, holistic and integrated primary care for clients. It is a care setting that facilitates partnerships among individual clients, client support systems and their primary care providers. Healthcare services in such setting is facilitated by disease registries, information technology, health information exchange and other means to assure that clients receive the necessary care when and where they need or desire it, in a culturally and linguistically appropriate manner. National Committee for Quality Assurance, 2011. Patient Self-Determination Act of 1991, PSDA, refers to patients, i.e., clients' rights to specify if they want to accept or refuse specific medical care and identify a legal representative for urgent health care decision purposes, known as Advance Directive including health care proxy. Then if they become unable to make decisions for themselves as a result of a serious illness, e.g., stroke resulting in a coma, the patients then receive health care services based on their wishes which have already been clearly documented at an earlier point of time when patients were healthier through their health care proxies decisions. Patient's Bill of Rights, a law that ensures that all clients receive individualized, patient, family-centered, considerate, and respectful medical care and treatments. It also emphasizes the client's right to be well informed of and educated about the diagnosis, prognosis, and indicated treatment and care options. In addition, it states that a client has the right to self-determination, to agree to or refuse treatment and be informed of the consequences of such decisions. Payer, the party responsible for reimbursement of health care providers and agencies for services rendered, such as the Centers for Medicare and Medicaid Services and managed care organizations. Payer, principal term, the person, agency, or organization that assumes responsibility for funding the health and human services and resources consumed by a client. The payer can be the client her, himself, a member of the client's support system, an employer, a government benefit program e.g., Medicare, Medicaid, TRICARE, a commercial insurance agency, a charitable organization or others. Payer representative, the person or organization representing the payer, health insurance agency. This individual is able to speak and make decisions on behalf of the payer and can be a case manager, a physician, medical advisor, claims manager or a quality management specialist. See also payer. Payer source is the individual or agency responsible for the expenses incurred during a client's healthcare encounter, either commercial insurance, government programs, charitable organization, personal, self-pay or others. PCPC, primary care provider. PECS, patient evaluation conference system. Peer review by health care practitioners of services ordered or furnished by other practitioners in the same professional field. Peer review. Organization, PRO, a federal program established by the Tax Equity and Fiscal Responsibility Act of 1982 that monitors the medical necessity and quality of services provided to Medicare and Medicaid beneficiaries under the prospective payment system. Per diem, a daily reimbursement rate for all inpatient hospital services provided in one day to one client regardless of the actual costs to the health care provider. The rate can vary by service, medical, surgical, mental health, etc., or can be uniform regardless of intensity of services. Performance improvement, the continuous study and adaptation of the functions and processes of a health care organization to increase the probability of achieving desired outcomes and to better meet the needs of clients. Peritransition, the period that surrounds a client's transition, before, during, and after a transition. Permanent and stationary P&S, when the condition of a worker who is suffering from a work-related injury or illness has plateaued to the point that additional medical treatment is not likely to improve the worker's condition. This point signals the end of temporary disability benefits and the need to examine the likelihood of permanent benefits instead. See also maximum medical improvement. Permanent partial disability (PPD), disability that is caused by either a work-related injury or an occupational illness resulting in some form of permanent impairment that makes a worker unable to perform at his/her full capacity. An example is loss of vision in one eye or amputation of a finger in one hand. Permanent partial disability benefit, a benefit payable to the employee for a lifelong disability resulting from an one job injury or illness and loss of function that is part